Savannah, the signature city of the South, noted for her many famous old squares, horse-drawn carriages, busy harbor, the Riverwalk, and nearby beaches. Savannah is also noted for its fresh seafood and magnificent old homes. However, many of these old homes may be contaminated with lead. Lead is a naturally occurring, bluish-gray metal found in small amounts in the Earth's crust. Lead can be found in all parts of our environment. Much of it comes from human activity, including burning fossil fuels, mining, and manufacturing. Lead has many different uses. It is used in the production of batteries, ammunition, pottery glazes, and devices to shield X-rays. Lead was an ingredient in paint until 1978, where its use in residential paint was outlawed in the United States. However, older homes may still be painted on both the inside and the outside with lead-based paint.
There are approximately 500,000 U.S. children ages 1 to 5 with blood lead levels above 5 micrograms per deciliter. This is the reference level at which CDC recommends public health actions be initiated. Lead exposure can affect nearly every system in the body. Because lead poisoning often occurs with no distinctive symptoms, it frequently goes unrecognized. Lead poisoning can cause learning disabilities, behavioral problems, and at very high levels, seizures, coma, and even death. According to the Georgia Department of Public Health, there are over 5,300 children in the state of Georgia with elevated blood lead levels at or above 5 micrograms per deciliter. This is significant because blood lead levels that low can impact a child's intelligence, hearing, growth, and leave a legacy of underachievement in school.
Lead poisoning occurs when too much lead builds up in the body. This health problem is of special concern for children who may swallow or breathe contaminated dirt, dust, food, water, or paint. Studies show that lead can be harmful to children's health even at low levels in the blood. Once lead is absorbed into the body, it enters the bloodstream and soft body tissues, such as the liver, kidney, and brain. From there, it can go to hard body tissues such as bone and teeth, where it can remain for years. Lead can damage the central nervous system and vital organs such as the brain, kidneys, nerves, and blood cells.
Young children aged 6 months to 6 years are at greatest risk of being exposed to lead because they often put things in their mouths. If these things contain lead or are contaminated with lead, children are at risk for getting lead poisoning. Lead can enter a child's bloodstream if the child eats soil, dust, food, or paint that has lead in it or on it. He can also be exposed if he drinks water or breathes dust that is contaminated with lead. Children may also be exposed to lead by putting lead-containing jewelry in their mouths or eating candy imported from Mexico that may be coated with lead-contaminated chilies or candy wrappers that contain lead. Cooking with or eating on imported pottery with lead-based glazes is another source of exposure. In addition, some folk remedy products may contain high levels of lead.
The most significant source of lead exposure for U.S. children are deteriorated lead-based paints and lead-contaminated dust. Lead-based paints were banned for use in housing in 1978. However, approximately 24 million housing units in the United States have deteriorated lead-based paint and elevated levels of lead-contaminated house dust. More than 4 million of these dwelling units are homes to 1 or more young children. This project participated in the Georgia Lead Hazard Control Program, and the process was pretty straightforward. First, the building was tested for lead-based paint hazards by a certified lead inspector. Next, a scope of work was developed that directly corresponded to the finished report. A certified contractor then took that scope of work and made sure that each of those particular pieces of the building were addressed in a way that corresponds with state standards. Finally, the home was tested one more time by a certified lead inspector to ensure that no hazards remained for the children in the family.
Georgia's Department of Natural Resources offers information on their website about how to safely renovate an older home. Always remember to shower and change clothes after working around lead dust, or if your work or hobbies involve working with lead-based products.
Children with lead poisoning may not look or act sick. Even if children do show some signs of lead poisoning, these symptoms can often be mistaken for other illnesses, such as the flu. The only way to know for sure if a child has lead poisoning is to test their blood for lead. If a high level of lead is detected early enough, steps can be taken to remove the child from further lead exposure, and the health effects from lead poisoning may be prevented or even reversed. However, if lead poisoning goes undetected, some children can develop permanent health problems.
Ask a doctor to test your child if you are concerned about your child being exposed to lead. Talk to your state or local health department about testing paint and dust from your home for lead. If you live in a house or apartment built before 1978, especially if young children live with you or visit you. Damp mop floors, damp wipe surfaces, and frequently wash a child's hands, pacifiers, and toys to minimize exposure to lead. Avoid using home remedies such as Arcazon, Greta, Palua, and cosmetics such as Kohl and alcohol that contain lead.
The Georgia Department of Public Health recommends that children's blood lead levels are tested at age 1 and 2. Children 3, 4, and 5 years of age should be tested if they have not been tested at 1 and 2 years of age, they live or regularly visit a house built before 1950 or a house built before 1978 with ongoing or recent renovations or remodeling. They have a sibling or playmate that has or did have lead poisoning. Children can get a blood test at their local physician or health provider's office, or call your local county health department to see if they offer blood lead test.
Environmental health specialists work for local public health departments and play an important role in the prevention, detection, and investigation of childhood lead poisoning. Every public health district in Georgia has environmental health specialists that are certified to conduct lead inspections and risk assessments upon notification of a lead-poisoned child. These environmental health specialists bridge the gap between the clinical results of lead poisoning by investigating the source of the exposure. They make recommendations to the child's physician and caregiver on reducing or eliminating the exposure. Occasionally, enforcement action against property owners is necessary. Environmental health specialists are a crucial component of a comprehensive and successful lead poisoning prevention program and play a key role in community education and prevention.
For more information about childhood lead poisoning, visit Georgia Department of Public Health's website at the link below. By following the simple steps in this video, you can protect your child from lead poisoning. Remember, test your house paint if it is older than 1978. Test your child at age 1 or 2, especially if you live in an older home. And follow lead-safe renovation techniques. Thank you.